To help manage stroke risk for our patients with atrial fibrillation, a lot of patients will require blood thinners, but every good blood thinner increases risk for bleeding. And we have patients that are at high risk for bleeding, but also high risk for stroke. In the past, we used to have to pick one or the other. Either you're going to have high risk for stroke or you're going to have high risk for bleeding. But in current era, there are new options for atrial fibrillation stroke risk reduction. We can actually close off the left atrial appendage, which is the part of the heart where most of the clots form, and get the majority of those patients off of blood thinners altogether. The left atrial appendage is almost like a windsock that hangs off the front of the top left chamber. And because of its irregular shape, when the heart's not pumping correctly, blood tends to pool there and cause clots. For our patients that can't be on anticoagulation, we're able to, using a device called the WATCHMAN, basically place a plug in the opening of the left atrial appendage. Heart tissue then grows over the plug and eliminates that space from the heart, so blood clots can't form there anymore. Although the WATCHMAN sounds like a terribly invasive procedure, it's actually done through a single IV in the leg, and we don't have to open the chest. Most of our patients go home the next morning.